Dr. Miller here with Integrated Health of Indiana, and I'm here to talk to you about the 4 types of tissue and why it is important to maintain your health and how it's important to these 4 types of tissue. So we're going to talk first about red tissue, then we're going to talk about white tissue, then we're going to talk about skull tissue, which is throughout the, or not skull, skeletal tissue, which goes throughout the body, and then nervous tissue. So when we look at this and we start to see this red tissue right here, and we look at what it does, what's the function of red tissue? And the function of red tissue is for contractile movement. When my arm moves this way, this contracts. When my arm moves this way, this contracts. And so when we do that, the white tissue here allows the body to give that motion boundaries. And so the reason why we don't walk around like the scarecrow is because this white tissue braces all of this, not allowing you to have excess floppy movement to the sides and stuff like that. The red tissue, which has a lot of blood flow, lots of fibers, is attached to the white tissue and to bone. The white tissue kind of overlaps these joints, these end parts, and this is your tendons and things of that nature. And so the red tissue comes down to a tendinous juncture. That juncture goes into the skeletal muscle, and that's what gives that structure, that strength, and that's why it doesn't just like pull off. And when we look at that and we start to look at the skeletal tissue is what everything hangs off of. And after the skeletal tissue and everything hanging off the skeletal tissue, we have the nervous tissue. And the nervous tissue wants to keep your center of mass in line. It wants to keep your head over your body. It wants your shoulders straight. It don't want you leaning forward. It doesn't want you leaning backwards. And if it does, then it tries to start to accommodate. And what happens, especially like with chiropractic, when you have subluxations in areas, it affects multiple things. So right now we're looking at the C3 vertebra. This is in the middle of the neck. And this works with retraction, head flexion. When we look at all of that, when you have issues with this vertebra, it can affect all of that. And so if you're standing there and you're all like this, all of a sudden, can that have an effect if your C3 is off? Well, yeah, because we got to bring the head back. That's going to require the traps. We're going to need to reinnervate all of this. And that allows the body, that reinnervation, that's a big fancy word for saying we're turning the power back on. We're bringing the electricity. We're bringing the communication of this muscle back into the spine and up to the brain. And so when we do that, that's how the body knows where things are in space and time. That's why I can close my eyes and I can touch my nose. That's the big fancy word for that is called proprioception. Proprioception lets you know where your body is at in space and time. And it takes the white tissue, the red tissue, the nervous tissue, and the skeletal tissue to give your brain all that information. And so when you have issues with subluxations or misalignments in there, then what happens is the body gets stressed and there's this constant flow of irritation. So when this is out of alignment, for you parents out there, it's like having kids. And the first kid is going, mom, dad, mom, dad, mom, dad. And you get to where you can ignore that child. And then all of a sudden a second child comes in. And then you got mom, mom, dad, dad, mom, mom, dad, dad, mom, mom, dad, dad, mom, mom, dad, dad. Little irritating, puts you on edge, but still you can handle it. Now let's go to bringing the third child in. Yeah, mom, mom, dad, dad, mom, mom, dad, dad, yeah. And so now all of a sudden you snap. What's going on? And you want to go crazy. And it's not the third child's fault. It's not the first child's fault. It's not really the second child's fault. It's all of those things. So is it the bill you got in the mail? Is it tying your shoe? Is it bending over to pick up the towel off the floor? No, it's a combination of all of those things that you do all of the time. Can you be inflamed? Yeah. Can you have a toxic burden in the liver? Yeah. And these things are all things that feed this. And it adds a layer upon a layer upon a layer of stress to the body, whether it's mental stress, physical stress, emotional stress, traumatic stress, whatever that stress may be. And so it's my job to get in here and look at how you move. And this is why we take yearly x-rays, to make sure that you're not going the wrong way. And we do ranges of motion. And so we don't want this to degenerate, because if we allow this, and so that's just the muscular system. Let's take a quick second here. Let's go back to C3. Where's C3? There's C3. It's touchy. If we look at C3 there, you turkey. Okay, we're going to look at C2. I can't get it to stay at C3. But that affects the entire scalp. As you saw, the C3 kind of affects the cape here. And that's skin sensation. So do you feel like you have things crawling on you? Do you itch? Or, you know, but there's nothing there? Well, that can be an irritation of the cutaneous, the surface nerves. Big one for patients around here are the C4, C5, and C6, because it all affects the arms. It all affects the hands. It affects the wrists. So when you see these things, I do not know why I'm having issues with that. Let's go down to C7. Hands and fingers going numb, especially these carpal tunnel-like symptoms. That's where that can be from. And that's why it's important that after we go through a treatment plan and we go from the acute phase into the corrective phase and we start doing correction and we're done with correction, it's very important to maintain, because you're going to go back to your lifestyle that put you in this place in the first place. And that's why we say about every 4 weeks, hey, come in, get adjusted. Do you change the oil in your car every 3,000 miles? Well, what's more important, you or your car? And so absolutely taking care of you, making sure your hands work, making sure your neck and head work, making sure all of these things work so you can use them optimally. And not only that, but if these things are all working, that's one less thing that is a stress or a burden to you. And if you have ligamentous injury, and let's say we've gone into the white tissue and we have a problem with the white tissue, and this has gone through a whiplash injury or whatever the injury may be, this posterior and longitudinal ligament gets stretched. It takes a long time for that to heal because it's white tissue. There's not a lot of blood there to heal it. If you've ever sprained an ankle, how long did it take for the ankle to truly heal? You probably were back on it within a week, but you knew something wasn't quite right. Well, that's the same way we talk about ligamentous injury. If we go from ligamentous injury and you have abnormal ranges of motion and you allow that to continue, and we start to look at abnormal postures being sustained, when you sustain an abnormal posture and you have that stress that's there all the time, then you push this inside jelly portion out. And that's where you get that disc bulge, or people have heard of a pinched disc, and they get it in the low back or they get it in the neck. These are things that, it's multimodal also. And that's the fancy word for saying there are many things that affect that. So if you're an alcoholic, if you drink a lot, if you eat lots of processed foods, if you drink a lot of fruit juice, these are all things that cause inflammation. And that inflammation makes things fire off wrong, and it causes subluxations. It causes the muscles to be tight and to hurt, and so then they won't do the things they're supposed to do. And as that happens to you, then your body has to compensate, because that's what the body is designed to do. The rest of this actually feeds this little pieces of your frontal cortex, is the part of your brain that the rest of this kind of serves. This is the boss. If we take this out, if you have a frontal lobotomy, you cease to exist. You're just kind of like a robot. And so this is what makes those decisions, and you can actually help control this, because it is the thought-making machine, which causes stress, which causes tension, which causes you to get tight. So being adjusted actually helps release endorphins, helps you relax. Jessica and I typically tend to get in a massage at least once a month. We probably should do it more. Finding that time, being busy parents and busy business owners, that it all has a cost, and we understand that. But we want to get everybody as healthy as they can be, and maintenance is part of that. So we see that disc bulge. We want to get in here. We want to adjust it. We can also use decompression on that. And when the disc bulge is in there, and we start to do decompression on there, what happens is that opens that up, creating a negative pressure inside that disc, allowing that shrinking to go back in. So regular appointments, especially when you're in acute care and you're just beginning, those appointments and the spacing of those appointments is very important. Then after that, we have to look at moving in here and maintaining what you've already built. And it's very, I mean, ask my patients who are wellness patients. They know when it's about time, and they get in and they don't let something bad happen. So we would love to see you. If you are having neck pain, back pain, headaches, from the functional medicine side of things, if you are having headaches that have been failed by chiropractic, pains, cardiovascular issues, high cholesterol, all of these things are things that we treat in a holistic way, and we would love to help you. So give the office a call, 812-346-1757, and we would be happy to help you. Thank you for taking this time to look into the health of you and your loved ones. This broadcast does not constitute a doctor-patient relationship. It is intended for educational and entertainment purposes only and is not a replacement or substitute for care. If you are having issues, please seek a qualified professional trained in functional medicine. We would be happy to be of assistance with both in-person and virtual consultations. Thank you.